Anyways, I didn't want to just leave that video hanging like that, the last one, so I'm going to talk a little more about lupus and stuff. I have, let's see, like 9 out of the 11 criteria that you have to have for lupus. I don't know what I just did, but I think I took a picture. So I have to delete that, but let's see. I don't remember them right now, and I can't use my computer to look it up because I'm using my webcam right now, but anyways. My neighbor, well, not my neighbor, my friend Danny, who used to be my neighbor because I used to live in his apartment complex, he thinks that I have cat scratch fever or cat scratch disease, which is possible, I guess, but not very likely considering it says the lymph nodes can be inflamed, but it's usually around the area that you've been bitten or scratched. And I don't have my lymph nodes inflamed around there. They're a totally different area in my stomach. So I really don't think that I have cat scratch fever or cat scratch disease. But my friend Danny was like, he thought I had it. He's like, I think I know what you have. When I went over to his place yesterday, and I'm like, I don't think so. But I'm just getting really frustrated with this, with everything, because nobody can figure out what is wrong with me. Depending on my CT scan results, if there's nothing wrong, my nurse practitioner that I'm seeing, which at this point I don't have a doctor because there's no doctor at my clinic right now. I don't know if there's a doctor now. They said sometime in August there's supposed to be a doctor, so there could be a doctor there now. But she said that she was going to give me a referral to a neurologist on the 12th. I don't know why she was going to wait till the 12th to give it to me instead of just giving it to me now, but she was, so. But she ordered the CT scan, so I don't know if she just did that because she didn't want to send me to the neurologist if there's nothing wrong, or like what she did that for, because you can use MRIs to look at the brain too. So, and a lot of the things you can look at in CT scans you can't see in CT scans. Like there's a lot of things you can't see in CT scans that you can see in MRIs. So, I don't know if like she's still going to refer me to a neurologist if everything comes back normal in my brain for my CT scan, or what's going to happen, but I hope she still refers me because I really do think that there's something wrong and that lupus could be causing my mental issues and the tremors that I've been having, because it just started happening like right after I got sick. So, and I've been having joint pains, which I haven't had for like a year and a half or more since I've been sick. That all started when I got sick. I don't know why I started having joint pains, but I think my if I have lupus, it was in remission for like a year and a half or more. So I think that's what happened. I think it was in remission if I have it. And now it's coming back. But I don't know. I shouldn't diagnose myself. I've been doing a lot of research trying to like get more of perspective on what it is, what lupus is, and like more information on it. so then I don't like really sit here and diagnose myself. I want to be able to know what's like the symptoms are and what other people have. I found out that people with lupus get a lot of urinary tract infections and vaginal infections, like yeast infections, and I have both. I've had about 20 not yeast infections, but 20 urinary tract infections in the past year, and that's a lot because most people do not get that many urinary tract infections if they get them at all. And I've had quite a few yeast infections. I don't know how many, but I've had multiple ones, and I have them all the time. So probably a lot of them go untreated because I don't realize I have them. But actually, I have to start taking an antibiotic tomorrow that I was given for a yeast infection that I have, and I kind of put off taking it for a while because I kind of forgot that I had it for my yeast infection, and then I just forgot to take it. So now that I realize that I have to take it, I'm going to start taking it so I can get rid of it. But let's see. I've also read that lupus can affect your menstrual period. I've had really light periods since I've been sick. To the point where I only have to use one tampon or something. I know that's TMI, but we're all grown-ups here. Or at least some of us are. Or I should say most of us are. More than likely. Maybe not, but I'm sure even teenagers have found out about menstrual periods, so it's not something that's really shocking to them, I'm sure. Let's see, what else did I find out? I found out a couple things about lupus that I did not know. Let's see, I'm trying to think. I covered the menstrual periods, I covered what was it? The lymph nodes, that's one thing that I didn't know. I didn't know that lupus can make the lymph nodes inflame, and that's one of the big signs, one of the big symptoms of lupus. If your lymph nodes are inflamed, you might have lupus. Or something else, like an infection or something. But, the fact that I had my appendix inflamed, and my lymph nodes inflamed, and that I have an enlarged spleen, is just kind of weird. It makes me think I have lupus. It really does. I have no doubt in my mind I have lupus. I'm not trying to diagnose myself, but have you ever had that gut feeling that something's not right? You know? Or knowing what's wrong? Just knowing it in your gut what's wrong? That's how I feel. But, and to make things matters worse, I have a cat that bites me all the time. One of these days I'll videotape him and put him on YouTube. But possibly while he's biting me. Just so you can see how bad he is, because he's really bad. He's like one of the cats that should be on My Cat from Hell. This TV show. But I'm running out of time, so I gotta go. I will post this video now. Bye.